Hello, everyone, and welcome to the Daily Rinse. This is episode number 15. I am your host, Christopher Barth, and today we will be briefly discussing a gummy smile. Are you walking around with a gummy smile? There are a lot of people that walk around with a gummy smile, and they might not know it, they might know it, it might bother them, it might not bother them. But I'm here to just give you a little bit of a factual information regarding this gummy smile that people may have, and maybe it'll help you talk to your friend that has a gummy smile and you were always afraid to talk to them about it, and now you know more, so you can tell them. So the gummy smile is what it sounds like when somebody smiles, or even sometimes at rest when they're just talking or sitting there. They have an excess of gum or gingival display, so it looks very pink when they smile. Like, I don't have one, but if I did, it would go up like this. You know, that's exaggerated obviously, but they have a very excess amount of gum showing when they smile. It's evident in pictures, maybe during daily conversation. And there are a few reasons somebody might have this, and they're all different. The first one of the big reasons is that there's an excess of vertical growth of the maxilla, or this part of your face. So when the individual has finished developing their facial structure, the upper portion of it has actually grown vertically in excess, and so they have more of that showing, and their lip tends to ride up, and you have a gummy smile. Which brings me to the next possible cause, or as we like to say, etiology, is a hyperactive upper lip. So some people have a hyperactive muscle tone, whether it's at rest or upon activation of it when they smile, and it lifts up excessively, showing the great amount of gum when they do perform those actions. And so that can also contribute to a gummy smile. And one of the third other possible cause would be a lack of or failure of the teeth to fully erupt, and this is called altered passive eruption, and this can just lead to an excess of gingival or gummy display, like I said, at rest, or it might just appear like they have really short teeth, these individuals, and so there are things you can do about this condition or this display. The first, regarding that vertical excess growth of the actual face, the bones of the face, that can be, I would recommend a consultation with an oral and maxillofacial surgeon, because they would be the ones that would be able to appropriately address details of any kind of corrective surgery or anything that you could do, or modality for that area of the face. For the hyperactive upper lip, one possible way to manage that would be actually injections of Botox, believe it or not. I'm not aware of any strong literature that supports long-term use of that, so take it with caution, but it is something you could look up and pursue. And then thirdly, you actually can do a lip repositioning procedure, which tends to show some rebound after a while, after about a year. There are some cases that do not show rebound, but I've done one case of that, and so far the patient is still happy with the appearance. Of course, that's just one case. The other modality to treat is sometimes we can do surgery, periodontal surgery or oral surgery in the front of the mouth that can cut away the gums or lengthen the teeth, if you will, to create that appearance of a normal-sized tooth, and thereby reducing from here to here the amount of gum showing when you smile. You'd see more teeth. And so this all depends on the different causes, obviously. You'd want to be evaluated by your doctor, dentist, or oral surgeon for anything looking into that. But that's just to give you a little bit of an insight into the gummy smile world. And let's see, I think that's it for that. Another plug, some folks have pigmentation in their gum that can make it look dark, whether it's all over the place or just around the lines of the teeth. It can vary, but that can also be something that can be managed as well with surgery or possibly a laser modality as well. So some people don't like the look or the appearance of that. So that's all I had to say about excess gingival display, aka gummy smile. Thanks for tuning in to the Daily Rinse, and you can always find me on Instagram, Twitter, and Snapchat at doc_gums. Please subscribe to the channel if you find this interesting, and I will see you all next time. Stay clean.